Patients often do not know how or when to use ice. This is again a perfect opportunity to provide self-care tips that are simple, cost-effective, and set your practice apart from the competition. Review the importance of ice and the importance of placing a towel between an ice pack and the skin. Also review the indications and contraindications of utilizing ice and cold packs. It's also helpful to create a fact sheet about the use of ice that you give to your patients when they leave your clinic or when you leave an out-call situation. For patients with acute soft tissue injuries, I'll show them helpful hints for applying ice. I very often will take a 9-ounce cup or even a 16-ounce cup to create large ice cubes. So the 9-ounce cup, for example, creates something approximately like this that I'm able to hold on to. I can treat multiple areas, whereas the 16-ounce cup, you can see, creates something much larger for me to work with. Now it can be kind of cold holding on to these with your hands, so what I'll use is I'll hold on to them with gloves. I utilize nitrile gloves whenever, because some of our patients are allergic to latex, so I'll utilize nitrile, and then the nitrile gloves really allow me to hold on to the ice. I'll take a towel so that any ice that may start to run on, from the skin or the area that I'm icing down at the moment, I'm able to capture that ice. It's also nice to have a warm towel, so sometimes I'll put the towels, I'll take them right out of my the steamer that keeps the towels nice, warm, and moist, and it's very comfortable for the patients. What I'll suggest the patients do is take the ice into the shower. There in the shower, they can hold on to the ice cube with a washcloth very easily. They're already letting the hot water hit them on the neck or on the back or on their shoulder. They'll let the hot water go ahead and hit that area, show them any stretches that you have wanted them to apply, and then they can take the ice and ice that area. Again, I show it to them right in the clinic, and then I'll ice the area. As I apply the warm towel to moist towel, that would be the same as them applying the leaning back into the shower. Also, when they're in the shower, any of the water that's running down their body from the ice, they can control very easily. You can see that just by having one glove on, it's easy for me to hold the ice. I'd suggest you ice a big area at a time. Short applications, ice it for, contrast it. I ice for about 10 seconds, approximately 10 seconds of warm towel, moist towel, and then I'll go back to another ice application. After about 3 or 4 applications, that whole area gets very numb, and it's very easy to show the patient how to utilize ice and how to work with ice. I can send them home with additional cups. Actually, what I'll do is I'll take frozen ones, because they're just not set up at home. It's going to take hours for the cup to freeze. So I'll put it right into some type of a plastic bag, and then this is part of what I'm sending them home with. If they're going to be mobile or in their vehicle for many hours due to work or whatever, many times I'll take a water bottle, and again, I'll freeze that. They'll need to keep a cloth always between their skin and whatever's cold, but that's another way for them to utilize ice, and for you to utilize ice to promote your practice, educate your patients, and help them provide self-care tips and care for themselves between treatment. Of course, again, in the fact sheet, you'll discuss the length of time ice should be applied, how it should be applied, again, indications and contraindications.